Hi, it's Dr. Nancy Zare, and I want to welcome you to a very up close and personal session that I am about to have with my therapist, Sharon Sharpe. And Sharon works at Achieve Therapeutics. She is a soft tissue massage therapist. So, Sharon, why don't you tell people what you do again and how we're going to, well, start with what you do.
Okay. Well, I do a lot of different light touch, soft tissue techniques. I don't do Swedish massage, but I do a lot of other things that are designed to release restrictions in the fascia, which can get bound up and posturally can get tight and unbalanced.
So I know what fascia is, but a lot of people don't know, and I know you are really good at explaining it. So would you help us understand what
Sure.
fascia is?
Yeah, fascia is, you think of an orange, and when you peel the peel off an orange, there's a sort of a covering still on it, and that's an outer fascia. And then when you pull the segments apart, those segments are held together by fascia. And if you keep opening it further, you'll find tiny little segments surrounded by fascia, and that's how our bodies are. We have a big layer all around, and there are lots of other layers underneath that are going in all sorts of different directions to facilitate the way we move.
Right. So if you are like me, those of you who are listening, and you've been stuck at home and you haven't been able to enjoy the benefits of massage therapy, especially soft tissue release, and I have absolutely benefited from working with Sharon, you are probably desperate. I'm desperate. So Sharon, I know that's tickling your funny bone, but Sharon has developed some techniques that we can do individually for ourselves. And if you have a partner, which I don't, your partner can do on you. So go have at it, Sharon. Here I am, guinea pig.
Okay. Well, hopefully you've come here having filled out a form and taken care of that. And also you've been moving around a little bit, so you're a little bit warmed up. And now I'm going to just ask you a couple questions. So like, why are you here to see me today, Nancy? What is it that's bothering you?
Well, thank you, God. I do not have any particular issues. And by the way, I've seen Sharon just because I want to maintain good mechanics, body mechanics. So Sharon, I am so grateful. I don't have a complaint today, but I do miss that relaxation and that feel-good stuff when I come away from having worked with you. So no specific complaint.
So then we're going to start. Well, what I would do, I mean, if someone has a complaint, then we would talk about what it is, how it occurred, and what I think it is, and then go from there in terms of how to try to relieve it. But if you're just sort of tight overall and you just want to loosen up, then I would just start you standing, which I don't know that I can do and still stay in the frame, but and just to bring the arms up overhead. Yep, palms facing forward, and then palms facing up. Can you go all the way? There we go.
Oh, sure, I can.
Yep. Okay, and then you're going to bring one arm across, and then come back and bring the other arm across. So we're just going to go back and forth a couple times like that. Okay. So you're just trying to loosen everything up. Okay.
So again, even if you have not seen Sharon, there are some wonderful movements that you could be doing to keep yourself limber. And clearly, if she and I were having a real session, we would take longer to do this.
Right. And then you're just going to roll your shoulders. So up and back.
And probably reverse it.
Up and forward.
Right.
And then you're going to alternate, like your best dance moves.
Ooh, I like it. I'm getting funky.
Okay.
Getting
so this
funky
is just
here.
to loosen up your whole shoulder area. It's much better if you have a buddy, because a buddy can do a lot more things than you can do on your own.
Okay, Richard Francois, are you listening? I need a buddy.
Need a buddy. Okay, so we're going to take a strap or a belt of some sort, whatever you have.
Okay.
And you're going to go on one side of your head. And you're just going to pull down. to stretch that side of your neck. Oh, my head's disappearing.
Yeah, I know. That's why I wanted to,
Okay, don't let
I
your
took,
body tip though, just your
oh,
head.
okay.
Yep.
Just my head. Okay. So that's the reason why I took away my virtual background, was so that people could perhaps see this,
Okay.
because I know
Well, I'm
virtual
gonna switch
backgrounds.
to the front and don't bend your body forward. Just pull your chin
Okay.
in.
Okay. This is, hi, I'm disappearing in the belt.
And then to the other side.
Right. Okay. So again, I'm not doing this fully, but it's just to give you an idea. Sharon has a whole protocol again for working with people individually, as well as working with couples. And this is something that you should definitely consider as a way of helping yourself during this time when we're still exercising social distancing.
Okay, so that's just the warming up part.
Okay.
So if you just take your arm, okay, and just put your fingers on it, and you're just gonna try to move that tissue,
Okay.
okay? So you're not pressing down deep, you're just trying to move your skin.
Okay.
And as you're moving your skin, you slide your hand out and see what you feel. You may feel lumps and bumps. You may feel pain. But this is the first step of treating yourself, is to just get a sense of moving that tissue.
Okay.
So you can either move it gently with your palm or your fingertips, or you can dig in a little with a knuckle.
Mm-hmm.
Okay, so this is just a different kind of techniques that I would be guiding you through based on whatever the problem was.
Right. Now,
I
Sharon
have some
knows
other,
that I broke my wrist some time ago, and I do have some stiffness in this arm. So I've actually been using a tool to help massage that. It's a roller that I guess is for the face, but I found it, and it works pretty well for my arm.
which brings us to our rolling
Ah,
device.
the rolling pin. I love it. I knew there was a reason that my grandmother gave me this rolling pin.
Yes. So this, you just can roll over that tissue. And everybody's heard of a foam roller.
Mm-hmm.
So this is sort of the poor man's version of that.
Okay.
And you can do that anywhere. You can do your neck. This is really good for a leg.
Ooh, yes,
Down
it's
your
very good for the
thigh.
thighs.
Yep.
Definitely.
It's really good for that.
Yeah.
So those big areas. And then there are some tools that I use in my office, but you probably don't have those at home since they're really expensive. And this is a fork. And I've selected this fork because it's got kind of a rounded handle. And it's got a little tiny bit of an edge on it. If you don't want a square handle, you don't want a sharp edge.
Okay.
Okay, and again, I'm using my arm just because that's the easiest thing to show you. And I'm just gonna drag that.
Okay.
Basically, you start from closer to your body and slide it out.
Okay.
So into out, into out.
Okay.
And you want to go along the muscles. And again, you might feel lumpy bumpy. That's okay. And if you've got a particularly sore area, and there's not a lot of pressure with this, you're not trying to inflict bruises upon yourself. Okay,
Okay. Good.
Just push
Good.
a little harder and just go over that particular spot.
Okay.
Kind of quickly, like this. And again, I'm not going to be showing you this and say, okay, have fun, go do that. I will be guiding you through every step.
So
If you want,
what Sharon is offering is a video consult, just like we're doing right now.
just like right now.
Exactly. Of course, I wouldn't be interrupting her. I'd be a better patient. But I'm interrupting her for the purposes of trying to help you, the audience, understand the benefits of having a professional like this guide you.
One more common tool
Okay.
that we like to use, especially in a situation like this, is it's better if you have a little bigger one, but that's the one you have. So
Yeah, I
that's what
don't.
we'll go with.
My dog is gone, no balls anymore.
Yeah. So this is really good if you have a back, upper back, lower back. because what you can do, and I'm not going to be able to show you this, but you put the ball between yourself and a wall,
Yeah, and you
and then
slide
you
up and
just kind
down.
of go up and down,
Mm-hmm.
up and
Sometimes I've
down with
done
your
that
knee.
on a doorway. I kind of like,
You could do
ooh.
it on a doorway. You can, like on the corner of a door, you can do that.
Mm-hmm.
But this is better because it gives you that one pressure point, and you can roll it again. You can roll it over
Mm-hmm.
whatever it is that's bothering you. And what this does is all these things are moving these tissue layers. And what that does is it separates layers of fascia that may be stuck together, and so they don't slide. So we're trying to break those up so that those layers can slide. And if you think about it, if I've got layers over here that aren't moving, and I go to raise my arm, I'm going to be limited because
Mm-hmm.
this fascia isn't going to glide up. It's going to stay here, and I'm going to be limited. So that's what we're trying to do, is restore freedom of movement by releasing those restrictions.
Fantastic. Well, I'm going to stop you there. But again, if you are a person in need of some soft tissue work, it's a little different than regular massage, but absolutely something I look forward to. Can't wait to make an appointment when Sharon is back, seeing people, person to person. And in the meantime, if you'd like to schedule an appointment with Sharon, it's Achieve Therapeutics. You see the phone number here on the
Mhm.
screen. And I can highly, highly recommend her
Thank you.
skills.
And we do hope to be back on June 8th. That's our earliest possible date. So if things go well, I hope to be back then, and I will have a whole page on my website how protocols have changed because of the COVID. But hopefully we could be back up and people can get some relief.
Excellent. Thank you so much. To your sales success and to your good health. This is Dr. Nancy Zaire.
Thank you, Nancy.